From today, the 11th of November 2021, all care home workers and anyone entering a care home will need to be fully vaccinated unless they are exempt under the regulations. Today, we are speaking to our drug and alcohol practitioner, Stefani, who is a general nurse by background and currently works as a clinical nurse specialist at Hillingdon Hospital, as well as being our designated drug and alcohol practitioner for the Keeping Well Hub. She works with many staff and patients from Black, Asian, and minority ethnic backgrounds and is going to tell us a bit about her experience around the vaccine uptake.
Thank you so much, Imogen. I'd like to start off by saying thank you to all of you who are continuing to work throughout this difficult phase that the NHS is facing. Thank you for turning up to work, wearing your masks, your PPE, and getting vaccinated. I'd like to talk a bit about my own experience around COVID-19 and the vaccine. When we were sent an email at work to book our first COVID vaccine back in January 2020, we all felt a bit of hesitancy. Myself and several of my colleagues from BAME backgrounds were initially quite adamant that we will not be getting the vaccine until there's further evidence on how it may impact us and any long-term side effects. I mean, the vaccine was developed so quickly, how do we know it's safe? Alongside that, I heard things like, oh, the government is doing this to control us, or it's going to mess up with your fertility. And all of these comments put together were telling me that taking up the vaccine is probably a bad idea and I shouldn't do it. I then continued to hear about deaths of extended family members, CNWL colleagues, and many patients. I decided to read about the vaccine myself. I read about both vaccines that are available at the time and felt reassured that sufficient evidence and clinical trials were conducted to make the vaccine safe for us to take. So here I am, triple vaccinated, plus I've had my flu jab, doing my bit to fight COVID-19. Knowledge and education was a vital contributing factor to my decision-making, and our aim today is to support you and guide you to all the things you may need to make this extremely difficult decision. So let's explore some frequently asked questions together.
First up, why is it important to have a vaccine in the first place?
So over the last year and a half, maybe a little bit more now, COVID has sadly taken many thousands of lives, in particular amongst older people, those with underlying health conditions and those who need the level of care provided in care homes. Despite the use of PPE and regular testing, we have seen outbreaks within care homes and nearly 14,000 care home residents have lost their lives since the start of this year. There is one thing now which is making a crucial difference and which is saving the lives of care home residents and staff, and that is vaccinations. Vaccinated people are better protected from severe illness and death as a result of COVID-19.
And how can we trust a vaccine that has been developed so quickly?
Well, even though the vaccine has been developed so quickly, all the standard safety procedures have been followed during clinical trials on vaccines for COVID-19, and the rigorous regulatory process has been fully completed as for any other vaccine or medicine. Before any vaccine can be given to the population, it must go through rigorous testing. Like all medicines, vaccines undergo extensive clinical trials where they are administered and monitored in groups of volunteers. No medicine can ever be completely risk-free or 100% effective. I mean, even paracetamol has side effects. However, strong licensing processes and safety risks ensure that the health benefits of medicines being given through the NHS greatly outweigh any risks. In the emergency state of the COVID-19 pandemic, the scientists, doctors, ethic approval boards, manufacturers, and regulatory agencies have all come together to work harder and faster.
I mean, I've heard people say that they've had really bad side effects to the vaccine. I mean, obviously that's depending on the person themselves, but is that true or is it false, or what could be the reasoning behind it?
So millions of people have had a COVID-19 vaccine, and the safety of the vaccines continues to be monitored. Like all medicines, the COVID-19 vaccine can cause side effects, but not everybody gets them. And most of them are quite mild and shouldn't last longer than a week. And some examples of side effects are like a sore arm, feeling a little tired, a headache, feeling a bit achy, or feeling or being sick. These side effects can last for maybe 24 hours or even a few days after you've had the vaccine. And personally, when I had my first and second and third vaccine, I felt a little unwell for the first 24 hours, felt a bit tired, had a sore arm, but I just took some paracetamol and went to bed, and I woke up the next day feeling completely refreshed. Now, that may not work for you, but it's, I haven't been very sick myself. I have heard of people who've been a little bit more unwell, but nothing too severe.
That's really, really good to hear. The next couple of questions we've received from staff who have had some concerns.
It is mandatory for anybody entering the care home setting to be vaccinated. And if you're unable to provide proof of your vaccination or exemption, then your manager should explore all other options for you. This could include moving you to an alternative role for which the vaccination is not required. I would advise that the staff member speaks to their manager as quickly as possible to see what can happen.
And if I were a staff member and I'm exempt from getting the vaccine due to medical reasons, will I still be able to work in a care home?
So there will be a clear process for staff to follow if they think they may have a clinical reason to be exempt. This is a conversation you need to have with your manager, and it may be beneficial for you to speak to them as soon as possible if you think that you are exempt.
Okay, good to know. And do I need to have the booster jab?
So no, boosters are not included in the regulations, but managers are advised to encourage workers to take up the booster vaccinations when they become eligible, and a provision for booster vaccinations may be added to the regulations in the future.
We are aware that a large number of health and social care staff and staff going into care homes, they have been vaccinated, which is great, but there is a small number that haven't. What would you say about that?
So yeah, I mean, it's great that we've seen such a strong take up of vaccination among care home residents and staff. We've got to remember that some who cannot be vaccinated and some for who the vaccination may be less effective. Some residents will therefore continue to be at a greater risk of the consequences of COVID-19. And now that winter's approaching, a potential combination of COVID-19 and flu would be life-threatening for care home residents who may be at high risk due to their age, underlying health conditions, or a disability. Vaccination against COVID-19 is the best way that workers can keep themselves and those they care for safe from the effects of the virus.
No, absolutely. And what support is available for staff who are worried or concerned about getting vaccinated? Where can they go to?
So if you are concerned or have any queries about getting vaccinated, we encourage you to have a conversation with your registered manager or your clinician to help you make an informed choice. The government has produced a range of resources, all of which are available in 19 different languages. And again, the links will be found in the caption of this video.
Brilliant. Thanks so much for talking with me today, Steph.
Thank you, Imogen. Alternatively, you can get in touch with the Keeping Well Hub. You should know our contact details by now, but if not, they'll be provided just here.